Hello everyone. So in this video we are going to discuss about some eye diseases which are normally prevalent, and also we are going to discuss about CNN network which aids in detecting the computer generated images. It can detect how it can detect and predict the disease. So what are all the eye diseases? So normally we see some patients who are affected with tumor of the eye. The first diagram here shows a small baby affected with a tumor in the eye. It can appear on the eyelid or it can be inside also. So eye neoplasma can affect all parts of the eye and can be a benign tumor or a malignant tumor, which is a cancerous one. It can be in the primary stage or it can be in the advanced stage also. So, do common cancers that spread to the eye from another organ, like breast cancer or lung cancer. That is, a patient affected with breast cancer or lung cancer can also have an cancer in his eye. The less common sites of origin includes kidney, thyroid, skin, colon, and blood cancer or bone marrow cancer patients. Normally, the cancer doesn't spread to the eye. So, as already discussed, the eye cancer can be on the orbit. The tumor can be in the lacrimal gland. Tumor can be on the eyelid or in the retina too. So here we have one more case of eye disease and cancer. It is presented by a small child of 7-year-old. It is most common in the small children's. So let us talk about another most talked about topic when we talk about eye disease is the diabetic retinopathy, or shortly known as DR. So it is an eye disorder which is a consequence of diabetes mellitus. That is, a patient continuously suffering from diabetes like is also affected, or the chances of those patients getting affected by diabetic retinopathy is high. DR causes inflammation and breach of retinal blood vessels for the formation of various irregularities in retinal lesions. It is frequently observed that a patient, when having a diabetic condition for longer duration, say from 10 to 15 years, is likely to get diabetic retinopathy. And statistics have also suggested that 80% of the diabetic patients suffering from protracted diabetes suffer from diverse phases of diabetic retinopathy. The process of early diagnosis can reduce the development of DR and susceptibility to severe blindness. So, this is the reason why we are throwing more importance on diabetic retinopathy. The earlier it is detected, the treatment process we can make such that the severity of the eye related disease at least doesn't progress. So now, having told about these two eye diseases, let us talk about the A part and the network which is going to help in diagnosing the diabetic retinopathy and cancer in the eye using artificial intelligence. So the most commonly used A model for predicting medical images is the convolution neural network, or in short it is also called as CNN network, and it is also mostly used wherever computer vision is applied. So why this network? It is the most prominent network which performs really well on medical diagnosis. And apart from this, we also have for diagnosis mostly CNN helps, and we also have other networks for like the recurrent neural network and the LSTM for image classification. Mostly CNN helps for projecting. We use RNN and LSTM. So a neural network normally has three layers, namely the input layer, a hidden number of hidden layers, and an output layer. The input layer is the part where we feed the input to the model. That is, it can be an image or a data, or like a collection of pixels are given as inputs. The hidden layer, these like inputs are given to the hidden layer. There are many hidden layers depending upon the model and the size of data that is to be handled. And the hidden layer consists of something called as neurons, which are actually numerous in number, wherein it is like a matrix which tries to manipulate the input into a usable forms, like using various functionalities, activation function, biases, and all those things, and presented to the output layer. The output layer is the one which gives the useful information regarding the input image. All data models are work with either feed forward or the propagation methodologies. So in this diagram, we present a model for a CNN architecture. As indicated, it consists of a input layer and an output layer. Mostly for medical, it is image input, so that will form the input layer. We have several convolution layers depending upon the application. These layers are increased or decreased depending upon the complexity of the input. And then after processing, we have the max pooling layer and the dense layers, ultimately given to the output layer. So let us come back to diabetic retinopathy and how it can be detected with the convolution neural network. So we need a data set. All AI models require huge number of data sets before it can give any useful information. So the images cannot be directly used, it has to be pre-processed. Whatever image is given, it has to be pre-processed. This is called as image pre-processing. And after this pre-processing, we get a very clear image, which can be used for something called as feature extraction. Feature extraction is nothing but getting useful information from the input image. And with the features, like we can classify the images. So it is also possible to give the severity of the diabetic retinopathy with classification. So in this model, this convolution neural network not only indicates whether that particular person is having diabetic retinopathy or not, but also can indicate the severity. Starting from no diabetic retinopathy, or the patient can be classified as a mild case of a diabetic retinopathy, then moderate retinopathy, severe retinopathy, and finally the proliferative retinopathy. So we can have about one, two, three, four, five or six classes, and we can ask the patient comes in and checks, like say every 6 months or uh, 1 year. We can tell them whether the disease is progressing or like they are safe. So, as already indicated, retinoblastoma (RB) is the most common ocular cancer worldwide and originates from immature retina cells, and also it is mostly in children. So, for this, mainly MRI images is suggested as the routine checkup to confirm the diagnosis and determine the disease extent. So the RB patients are now assessed qualitatively to support diagnosis and gain insight into tumor extent and to assess uh, metastatic risk factors. So other types of cancer also can be diagnosed by using MRI. So how to do all these things? For diagnosing cancer, because it is a tumor, we need multiple dimension. A two-dimensional image is not enough as in the case of diabetic retinopathy, but we need multiple angles of the tumor to get useful information. So again, here if we see, we have a 32 by 32 inch like input for this example, where again in three dimensional we are trying to get the data. We can scale the images uh, to get an output. So this is the schematic representation of a multi-view convolution neural network architecture. Three multi-view branches built up each anatomical plane within a scale block, the output of which is concatenated and used as input for multi-scale branched architecture. So and followed by, we need multiple images for doing the classification, either it be a convolution network, recurrent neural network, or LSTM or multi-layer. So we need a lot of images first, and when it is given to the algorithm, it predicts whether it belongs to any category or not. For doing that, we need a training phase where 80% of the data is used for training the model on which is labeled whether the particular person is having illness or not. Based on the training data, when we give the new data, it can uh, classify the diabetic retinopathy condition what we were discussing, or the tumor condition, whether the tumor is there or not. All those things it can. So thank you.